Hello there, my name is Andrew Kohlmeyer. I'm at Andrew Kohlmeyer Massage Therapy, and today I would like to talk about medical massage for anxiety. So anxiety, everybody thinks is something that is just their own pure emotions. That is just not the case. What happens is you have an action potential increase in your muscles, and what that is, that's the electrical value of your muscles. Once they hit a certain threshold, they're just firing on their own. And how that happens usually is you have poor lymphatic flow to your heart. So lymphatic flow to your heart is really important, or you have basically swelling in the body, and that causes chronic inflammation, and then you have that reaction. This kind of ties into my first video on lymphatic drainage just by itself. But what people have, which is really common, is anxiety caused by this reaction. And what happens is you start to release more adrenaline and cortisol into your bloodstream from your adrenal glands, which are located above your kidneys. So I will go over again about the lymphatic drainage and how to achieve that efficiency back to the heart. So the upper trunk it's important to have it reduced here in tone. This is your cisterna chyli, and this is responsible for draining everything out of the legs. So this needs to be of a decent tone here. So there'll be mineralization along where this cisterna chyli is, and then you have every vertebrae which drains into a thoracic duct. So here would be like the lines off those as such. So again, the mineralization or deposits, just kind of general like a higher tone. So that has to come out, and then it'll be like, here's your scapula, and it'll be, again, everything has to flow up through and around the scapula into the subclavian veins, which are located right about there. So that has to be reduced, or you'll get anxiety from that action potential increase. So that's an electrical value. So you're basically energized like 10% or so in your body, and you can't really perceive that. So yeah, it's kind of a really big issue, and people get they try to treat it with pharmaceutical drugs, but people also try to treat it with street drugs and alcohol, because basically it kind of works, but not good. Obviously not good to have that. So again, you'd be reducing the mineral deposits by going in there, and that's primarily deep friction. So again, you're going to be focusing on this cisterna chyli to reduce the pressure in the legs, and then again along the vertebral edges, same kind of thing. You can kind of get the gist in there, and again along the scapula edges, and then you'd be working along the neck, the border of the neck, and the clavicle right there. So this is a really great position, because your client isn't going to be tense from holding their neck. Sometimes you see that trying to be achieved in the upright position, face up, and that's just it's going to be really hard to be successful at that. So again, so once you get all this out, the electrical value goes down, and they relax. They stop releasing adrenaline, cortisol in there, and then the relaxing drugs can kind of get in there, and it is a beautiful thing to see that immediate response and change in your clients. So that is, in a nutshell, that's medical massage's approach towards anxiety, and boy, it really works. All right, again, Andrew Kohlmeyer at Andrew Kohlmeyer Medical Massage. Thank you.